how do we approach those patients, specifically females? If someone has diffuse pattern hair loss and you've excluded thyroid, hormonal, iron deficiency, psychiatric concerns, and you're looking to restore their follicles, the approach would be optimizing medications, perhaps using stem cell, adipocyte, or bone marrow, PRP therapy, organic therapy, and ensuring that the products you're using are organic, sulfate-free, propylene glycol-free. That's how you give them the best shot in terms of restoration. In someone with diffuse pattern hair loss, the follicle in the donor region is also affected by this entity. Our patients who sometimes have stronger donor regions, and you can restore hairline, midline for them to achieve a cosmetic result, but you really try to optimize. The second subtype of female patients with androgenetic alopecia, the pattern of hair loss they have sometimes follows male with temporal recession. And typically what you do, in some you can restore temples and hairline. In others that have midline thinning, especially with longer hair, you can restore the midline, then they come back if need be, and then you restore the sides to it. And that's how that type of hair loss progresses. We have female patients, androgenetic hair loss, and it could be psychologically paralyzing, as it can be in men.